The member for Goldstein.
Thank you, Speaker. My question is to the Minister for Health. Will the Minister update the House on how the Coalition's prudent economic management enables the government to list vital drugs which save and improve lives? And how does this compare with other approaches?
The Minister for Health has the call.
Thank you very much, Mr Speaker, and I want to thank the member for Goldstein, who's been a strong advocate for the listing of new drugs such as Kalydeco and Entresto and Stelara, which have helped people with many different conditions. In order to do this, though, of course, there has to be a very solid approach to economic management. There are two fundamentals to the way in which we've been able to do this. Firstly, the way in which the Prime Minister and the Treasurer and other members of the government have been able to deliver strong jobs growth and strong economic growth of this year predicted to be 2.75%. In addition to that, we've been able to make a fundamental agreement with Medicines Australia to ensure savings of $1.8 billion in medicine costs, which will be reinvested fully to allow us to list new medicines in a timely manner. This has been a unique agreement which has brought together both medicines, economic management and patient care. In that context, only recently, last week, the Prime Minister and I were fortunate to be able to list a new drug, ibrutinib. Ibrutinib is a drug which supports patients with leukemia and also with lymphoma. And what that means is that we have a drug that would otherwise have cost $187,000 a year for patients, available for $38.80 or $6.30 per script. A dramatic change to bring this life-saving, literally life-saving drug into the reach of all Australians who qualify and require it. It follows on from what we were able to do not long ago with the listing of Opdivo. Now, Opdivo is an extraordinary immunotherapy. It's part of the new wave of immunotherapy which is literally bringing the opportunity of life to people from around the world. On this occasion, it was available for lung and kidney disease. 4,500 Australians at a cost of $1.1 billion will be able to access a drug which for them would have been over $130,000 per annum. So that's one approach. That's about listing all of the drugs which are recommended by the PBAC. The alternative approach, when you don't manage the economy properly, is what we saw under the previous government, where they deliberately deferred, extraordinarily, drugs for schizophrenia, for asthma, for pulmonary disease, for endometriosis and for IVF, which have all been approved by the PBAC. So if you want a definition of good economic and good health management, that's what we're doing. If you want a definition of bad economic management and medi-fraud, nothing more than medi-fraud, it's their approach to listing drugs on that side. We're doing real things to help real patients